Welcome to STEMConnect Global, where we connect science, innovation, and real-world impact. In our last explainer, we talked about how numbers are basically the language of public health. Well, today we're going to zoom in on two of the most important words in that language, incidence and prevalence. Think of them as twin lenses that help us see exactly how a disease shows up, spreads, and sticks around in a community.
So every health story really starts with a number. You see headlines just like this one all the time, right? 500 new cases. I mean, that sounds like a lot, and it's definitely meant to grab your attention. It tells us something is happening right now. But what does that number, all by itself, really tell us about the big picture?
And that is the million-dollar question. Are these 500 new people joining, just a handful of others who are sick? Or are they being added to a massive pool of tens of thousands of people who are already suffering? Answering that one question is the key. It's the difference between understanding a sudden downpour and realizing the whole city is already flooded.
Honestly, trying to make big public health decisions without knowing the difference between new and existing cases, it's like trying to drive down a highway with a completely fogged up windshield. You just can't see where you're going. Are we heading into a brand new outbreak? Or do we need to be planning for long-term care for thousands of people? These metrics are what wipe that fog away and give us the clarity we need to act.
Okay, so let's grab our first tool for clearing that windshield. And that tool is incidence. The best way to think about incidence is like a speedometer for a disease. It's all about how fast things are moving, measuring the speed and the risk of new cases popping up.
So the official definition is pretty straightforward. It's the number of new cases that show up in a specific time frame, divided by the population that was at risk of getting sick in the first place. This isn't just about counting sick people. It's about measuring probability, the actual raw risk that somebody in that group is going to get this disease.
Let's make that real, though. Let's go back to that dengue headline. Imagine those 500 new cases were in a city of 100,000 people, and this all happened in 1 week. Well, the incidence rate would be 5 new cases for every 1,000 people per week. See, all of a sudden that big, scary headline number has context. It's a specific, measurable risk that health officials can actually track and do something about. All right, let's switch gears and look at our second tool, which gives us a completely different view. If incidence is the flow of the water, then prevalence is the pool. It's not about how fast a disease is spreading, but how widespread it is right now. It's a snapshot of the total disease burden. And here's the crucial difference. Prevalence counts everybody who has the disease at that moment, the brand new cases, and all the people who've been living with it for a while. So it's not measuring your risk of getting sick, it's measuring the overall weight, the burden on the healthcare system and the community as a whole. Okay, and this is where it gets interesting, because we can measure that burden in a couple of ways. You've got point prevalence, which is like a single snapshot in time. You take a photo on January 1st and see, okay, 3% of the town has hypertension. But then there's period prevalence, which is more like a time-lapse video. It looks at the entire year and captures everyone who had that condition at any point during that 12-month span. Now, this right here is probably the best way to understand how these two ideas are connected. Just picture a water tank. Incidence is the faucet. It's the new water flowing in. Those are the new cases. Prevalence is the actual water level in the tank, the total amount of water that's accumulated. It's a super simple analogy, but it's absolutely key. And this is where it gets really fascinating. That water level, the prevalence, doesn't just depend on how much water is flowing in, it also depends on the outflow. How fast the water is draining out. Think about cholera. You might have a super high incidence, a fast inflow of water, but it's a short illness, so the water drains out really quickly. That keeps the overall water level, the prevalence, low. Now, compare that to a chronic condition like diabetes. The inflow is much slower, but the drain is tiny. People live with it for decades, so that water level just keeps rising and rising over time, leading to a very high prevalence. Okay, so we've got our two main tools down. Now it's time for a pro-level technique. Standardization. This is what we use to make sure we're making fair comparisons. Because, as you're about to see, just looking at raw numbers from two different groups can be incredibly misleading. Let me ask you this. You've got two cities. City A has a much higher death rate than City B. So your first reaction is probably, wow, City A must be a way less healthy place to live. But is that really the whole story? What critical piece of the puzzle might we be missing here? So here are the raw numbers, what we call the crude rates. And yeah, City A looks a lot worse for sure. But what if I told you that City A is a huge retirement community full of seniors, while City B is a college town packed with young people? The age structures are totally different. We're not comparing apples to apples at all.
And this is the magic of standardization. When we use math to adjust for those age differences and create a level playing field, the picture completely changes. The death rates are now almost identical. The big difference we saw before wasn't really about health at all. It was just about demographics. Standardization lets us see the truth hiding behind the raw numbers.
One really practical tool for this is called the Standardized Mortality Ratio, or SMR. It's often used to see if a specific group, like workers in a certain factory, are at a higher risk. And it's basically a three-step check. First, you figure out how many deaths you'd expect to see based on standard rates. Second, you count how many deaths you actually observed. And finally, you just make a ratio out of it. An SMR of 120 means you saw 20% more deaths than you expected, and that is a huge red flag that something needs to be investigated.
So we've walked through incidence, prevalence, and standardization. But why does all this matter? I mean, why go to all this trouble? Because these aren't just numbers on a spreadsheet. These numbers are the foundation for real-world actions that actually save lives.
So let's do a quick recap of our toolkit. Incidence tells us about new cases, the risk, and that helps us spot outbreaks early. Prevalence tells us about all cases, the burden, and that helps us figure out the load on our hospitals and clinics. And standardization lets us make fair comparisons, so we can put resources where they're needed most. And you see this toolkit in action literally every day. Think about the daily COVID dashboards. That was all about tracking incidence. When we plan how many diabetes clinics a state needs, that's based on prevalence. Comparing cancer rates between different countries, you have to use standardization to do that fairly. And that SMR we just talked about, it's used to keep workers safe in their jobs. These are not abstract ideas. They are vital everyday tools. And really, that's what this is all about. Here at STEMConnect Global, we truly believe that understanding these concepts is what turns numbers into meaningful action. Because at the end of the day, health isn't just measured in cases and rates, but in the actual lives we can protect through knowledge. Thanks so much for joining this explainer.